Today in this lecture, we are going to talk about filterability of different substances at the glomerulus and relationship of filterability with molecular weight of different substances. Normally, the filterability of different substances is inversely relationship with their molecular weight. As the molecular weight keeps on increasing, the filterability of substances at the glomerulus keeps on decreasing. Basically, filterability is important in urine formation and especially in the filtration. As we have started discussing the process of urine formation, and we started discussing that there are different steps in urine formation. The first step is the filtration, then reabsorption, and finally secretion. And the filtration begins when the blood vessels, the afferent arterioles, bring the blood to the glomerular capillaries. In the glomerulus, the filtration occurs. The filtrate moves into the Bowman's capsule, and from the Bowman capsule, the filtrate keeps on moving to the nephron tubules. And the remaining blood enters the efferent arterioles, and from the efferent arteriole, the blood keeps on moving towards the peritubular capillaries. The peritubular capillaries either helps in secretion of some substances or reabsorption of some substances from the tubules into the capillary bed. Now, the first step in urine formation, the filtration. And for filtration, the filterability is important. And for filterability, the molecular weight in charge of substances is important. So we are basically going to discuss the filterability in relationship to the molecular weight and its overall effect on the filtration and urine formation process. So in the filtration process, we also discuss the glomerular capillary membrane. This is the glomerular capillary membrane, or this portion has been enlarged. We previously discussed in the glomerular capillary membrane lecture that this membrane, the GCM, is basically made of three layers: endothelium, basement membrane, and epithelium. Inside is the endothelium, then the basement membrane, then the epithelium. Now this membrane basically is a barrier to the filtration of plasma proteins basically. So this membrane makes sure that proteins should not be filtered. Although there are three layers and it is a barrier, but still it allows a lot of substances to get filtered because there are fenestrae in the endothelium and slit pores in the epithelium. And similarly, there are spaces in the basement membrane as well, which allows a lot of substances to move from the endothelium towards the epithelium and then the Bowman's capsule. So blood comes, it gets filtered, and the final process of filtration process occurs through this membrane, which is the glomerular capillary membrane. While substances are filtered through the glomerular capillary membrane, and these substances have to pass through these fenestrae, the fenestration, and these slit pores, the molecular weight of the substance is very much important. Now, if the filterability of a substance is 1, it simply means in the filtration process that it is as easily filtered as water, because the filterability of the water is 1. The molecular weight of the water is also small. There are some other substances like sodium, glucose, inulin. Their filterability is also 1, or their filterability is as easy as the filtration of water. Now, when we come towards the proteins, the myoglobin has a high molecular weight. Similarly, the albumin has a larger molecular weight. So their filterability, the probability of these substances to get filtered from plasma towards the Bowman capsule or from plasma towards the Bowman capsule decreases. If we see the filterability of the myoglobin with the molecular weight of 17,000 is 0.75, or it simply means that if it starts filtering, its filtration will be 75% as easy as the filtration of water. So it is less than the filtration of water. Similarly, the filtration of albumin is far, far less than filtration of water, and its molecular weight is very large. So in this lecture, we simply want to explain that the urine formation starts with filtration, but filtration has to occur through the glomerular capillary membrane. And in this glomerular capillary membrane, the molecular weight of the substances which are filtered is very important. If a substance has low molecular weight, the probability of its filtration or its filterability is very high. And if the molecular weight of substance keeps on increasing, then the probability of its filtration or its filterability keeps on decreasing. Normally, electrolytes have low molecular weights and they get as easily filtered as water, and their filterability is normally 1. And larger molecules have less filterability, or filterability factor is less than 1, and they are less easily filtered. So that's a simple, easy lecture about the filterability and its effect with the molecular weight. Thanks a lot for watching the video.